Well, June is Migraine Awareness Month. Migraines are the most common neurologic problems in humans, but less than half of the people who have migraines are actually accurately diagnosed. Kids are no exception. They're getting migraines too. Children's Hospital Colorado's headache program is one of just a handful like it in the country. Today we've got Dr. Marcy Yonkers here with us. Thank you so much for joining us.
You're welcome.
I think a lot of people, when they think migraines, they're thinking, oh, adults, but that's not really the case. So this could be afflicting kids as well.
Absolutely. The truth is that most adult migraine starts in childhood. And most girls start to have migraines around the time that they go through puberty.
So, I grew up with my mom watching her have migraines. And, as a kid, how do you tell the difference between, oh, I just have a bad headache versus this is something else?
It's the same thing that you see in adults, actually, and usually the parents who have migraines identify it quicker than their doctors do sometimes because they see the disability that goes along with it. Usually people who have migraines can't go on about their business and continue to do what they needed to do when they have a migraine.
So what would be your first step? Do you go to your family practice doctor? Is there somebody special that you should be going to see?
I think your family practice doctor is the first person to check with. There's a lot of good evidence these days about how to treat this and making sure that that's what the problem is and that there isn't something else is going on is a good way to start.
How common would you say this is for kids?
It happens in 5 to 10% of the pediatric population of the United States, so it's a very, very common problem.
It's interesting because we just talked about how a lot of people are not accurately diagnosed. So what is happening with that, and what are some questions a person can ask to make sure that they are being treated the right way?
That information actually comes from adults, and the American Headache Society went on a campaign to try to educate doctors about how to diagnose migraine. And I think they improved the rate of migraine diagnosis from 40% to 50% over 10 years in trying to, so unfortunately still a long way to go. The keys to migraine are that the headaches are medium to bad, that they're usually associated with either sensitivity to light or sound, or nausea, or sometimes vomiting, which is usually how kids present and get a lot of attention, because when your child is vomiting, it's hard to ignore them.
Yeah, there's something going on.
And the key is that it really interferes with routine activities. And so people who have tension type headaches or more mild headaches, it doesn't usually stop them from doing things.
All right, so this is something then, if it's a repeating problem or if it's that extreme, that maybe this is a question you need to ask your doctor.
Absolutely.
All right. Anything else you would want families to take away today? If maybe this is something that they didn't think about, they would need to ask?
Absolutely. One of the mythologies is that migraines are caused by something wrong with your brain. And in fact, they're a genetic condition. There's nothing wrong with your brain that causes the symptoms of migraine. So often people will hear, oh, my child's having migraines, I need to see a neurologist. And they sort of presume the worst. But the truth is there's very little that causes the symptoms of migraine that's bad.
Okay.
So it's actually reassuring to know that it's a migraine diagnosis and it's a treatable problem.
Exactly, right? So there's a solution, so go ahead and ask.
Absolutely.
Thank you so much for coming in.
Thank you.
I really appreciate it. Good words of advice, Tom.
Yeah, for sure. Thanks, Anusha. Thanks, Dr. Yonker.